Today I will talk about diarrhea. And first of all, we should know that there are two types of diarrhea, large gut diarrhea and small gut diarrhea. And then we should know that what are the characteristics of small gut and large gut diarrhea, because otherwise we will be unable to understand while we are taking history from the patient that whether he's suffering from small gut or large gut diarrhea. Small gut diarrhea is of two types, acute and chronic. But before this, that we discuss small gut diarrhea in detail, we will tell you something about the characteristics of small gut diarrhea. Since most of absorption it takes place in small gut, so small gut diarrhea it has got large quantity. It is watery in consistency, and sometimes it has got fat. Then it is called steatorrhea, and then it becomes difficult to flush. And stools, they are bulky and foul smelling. Since small intestine is diseased in small gut diarrhea, so absorption cannot take place. So it is large volume diarrhea. As far as the large gut diarrhea is concerned, of course, since most of absorption has taken place in small gut, so large gut diarrhea is usually very small in amount. It might contain mucus, might contain blood. Sometimes it is associated with tenesmus, that is feeling of going back to the washroom even after defecation, which shows actually involvement of rectum or proctitis. Then we'll discuss about small gut acute diarrhea. First of all, we'll discuss infectious causes like E. coli, Staph aureus, Bacillus cereus, Campylobacter, Salmonella, Shigella, Giardiasis. So all these diarrheas, they are acute infectious small gut diarrhea. Then another type of small gut diarrhea is malabsorption diarrhea. This is the second category of small gut diarrhea, where there is malabsorption because of villus atrophy, which happens in celiac disease, in tropical sprue, in Whipple disease, which is a multi-system disorder. Then there is a condition which is called tropical sprue. Then lactose intolerance, in which there is a deficiency of an enzyme which is called lactase, and lactase it actually split lactose. So when it is absent, so lactose is not digested and hence it is not reabsorbed. Motility disorder, small gut diarrheas, for example, scleroderma is an autoimmune condition in which the muscles of the intestine, they are replaced by fibrous tissue. Then there are miscellaneous causes like iatrogenic, if somebody has done laparotomy and has done some procedure on intestine. Sometimes blind loops are formed, and in these blind loops there is stasis of intestinal secretions, and stasis is, favorite place of bacteria, and then they grow over that and they can cause diarrhea. Then there can be other causes of diarrhea as well, like drugs, laxative abuse, and many other medicines which can cause small gut diarrhea. Then large gut diarrhea, most common cause is ulcerative colitis, then CA colon, then amoebiasis is one of the very important cause of large gut diarrhea. Diverticulitis, again these are small pockets which are present in the large gut or intestine where there is stasis of secretions, and as I have already told you that these areas, they are favorite places for the bacteria to grow. Then there is another kind of diarrhea which is called pseudomembranous colitis, because a sort of pseudomembrane is formed on large intestine, and it is produced because of prolonged use of antibiotics, especially cephalosporin, clindamycin, and omeprazole. So this is another type of diarrhea, but usually we get the history of prolonged use of antibiotics or omeprazole. So this was all about the types and the categories of the diarrhea. In the next lecture, I will discuss about small gut diarrhea. Thank you.